Suvorexant, also known as Belsomra, Pharmacology and Clinical Application. In this lesson, we will cover the mechanism of action, dosing protocols, critical safety warnings, and patient education points. Hello everyone and welcome back. My name is Osevwe. Today we are talking about Suvorexant, brand name Belsomra. Remember, this education is for learning purposes only and does not replace professional medical advice from a healthcare provider. Alright, let's talk about Belsomra. We're going to keep this simple and avoid turning sleep science into an obstacle course. Our goal is to understand the medication in a way that patients, students, and providers can actually use in practice. Belsomra is a prescription medication used to treat insomnia in adults, whether it's falling or staying asleep. Insomnia means persistent difficulty with sleep quality or duration that negatively affects daily life. Belsomra belongs to a class called dual orexin receptor antagonists. Let's break down what that actually means. Orexin is a chemical that helps keep the brain awake and alert during the day. Belsomra works by blocking it. Think of it as turning down the brain's stay-awake alarm at night so sleep can happen more naturally. Crucially, Belsomra is not a benzodiazepine or a Z drug. It doesn't use the GABA system to push the brain down. Think of the brain at night like a security guard who won't clock out. Belsomra politely tells that guard to go home. It is indicated for adults struggling with sleep onset, maintenance, or poor restorative quality. A patient might say, "I'm exhausted, but my brain won't shut off." Belsomra targets that exact signal. As a dual antagonist, it blocks both OX1 and OX2 receptors, removing the stay-awake message entirely. While it's different from benzos, Belsomra is still a Schedule IV controlled substance in the United States. This means there is potential for misuse. It must be taken exactly as prescribed and never shared with others. Let's look at the numbers. Dosing is typically once nightly, taken right before the patient goes to bed. The common starting dose is 10 milligrams. While it ranges from 5 to 20 milligrams, 20 is the maximum daily dose. Only take Belsomra if you can stay in bed for at least 7 hours before you need to be active again. The goal is better sleep with safe morning function, not waking up with your brain wrapped in a blanket. Take it within 30 minutes of bedtime. Don't take it and then try to finish laundry or do chores. Food can delay the effect. A high-fat meal might make the medication take longer to work. Side effects can happen. The most common ones include sleepiness, headache, dizziness, and fatigue. Some patients also report dry mouth or unusual dreams. Report any persistent grogginess to your provider. Belsomra can impair alertness the next day. This affects driving, decision-making, and balance. The risk increases if the dose is too high, if you don't get enough sleep, or if combined with alcohol. A major contraindication: Belsomra should never be used in patients with narcolepsy. Since narcolepsy is a disorder of sleep-wake regulation involving orexin, this medication is inappropriate. Belsomra is a CNS depressant. Combining it with alcohol or benzos is a major safety problem. Avoid alcohol, benzos, and other sedatives. Sleep medications do not like freestyle combinations. Watch out for complex sleep behaviors like sleepwalking, sleep eating, or even sleep driving. If you wake up and the car has moved or the kitchen is a mess, report it to your provider immediately. Sleep paralysis and hallucinations can also occur as the brain transitions in or out of sleep. These can be scary but are often sleep transition phenomena that need clinical review. Monitor for mood changes. Worsening depression or new suicidal thoughts require urgent attention. If mood safety is a concern, call 988 in the US or seek immediate emergency care. Do not sedate a problem that needs diagnosis. Providers must rule out sleep apnea first. Untreated sleep apnea can mimic insomnia. We must treat the underlying breathing issue, not just mask it. The liver is part of the plan. Belsomra is not recommended for patients with severe liver impairment. It is processed through the liver's CYP3A pathway, which leads us to important drug interactions. Certain medications can significantly raise or lower Belsomra levels in the blood. Strong CYP3A inhibitors can increase side effects, while inducers like rifampin can make it less effective. Families play a key role. They should monitor for drowsiness, falls, or sleepwalking at home. The family is the first line of defense for identifying safety concerns or complex sleep behaviors. Medication is a tool, but it works best when combined with healthy sleep routines. Habits like consistent wake times and reducing late-day caffeine help keep the door to sleep open. Let's bring it all together. Belsomra is a dual orexin receptor antagonist used for adult insomnia. It blocks wakefulness signaling, is not a benzo, and is a Schedule 4 controlled substance. Remember the 10 mg starting dose, the 7-hour sleep rule, and the danger of mixing with alcohol. Dosing and timing are critical. Alcohol and other sedatives must be strictly avoided. Watch for narcolepsy contraindications and report any complex sleep behaviors or mood changes. Safety is our priority. Complex behaviors and worsening depression are reasons for immediate follow-up. When used carefully and combined with healthy routines, Belsomra can be a powerful tool for sleep. For support, text 83299 or join our mentorship family at our Academy website. In our next lesson, we'll dive deeper into benzodiazepines and Z drugs to compare their profiles.